Have you recently noticed a curve in your penis that wasn't there before? At first, it may seem like nothing more than a small bend, something you could ignore. But over time, it becomes harder to dismiss. The curve grows, the discomfort increases, and with it comes an uneasy question. What is happening to me? For many men, this sudden change is more than physical. It touches confidence, intimacy, and even identity. Some begin to avoid closeness out of shame. Others carry the secret in silence, hoping it will somehow go away on its own. But silence does not bring answers. What you are experiencing has a name: Peyronie's disease. It is far more common than most realize, yet it remains hidden because men rarely speak about it. And here is the most important part: you are not powerless. In the next few minutes, we will explore what Peyronie's disease really is, how it develops, and the options available today to help. From natural approaches to medical advances, you will see that solutions exist and hope is real. If this feels like what you're going through, stay with me until the end. And if you want to keep learning about men's health after 40, subscribe now so you do not miss the next step in this journey. Peyronie's disease is not a rare or exotic condition. It is a connective tissue disorder that develops quietly, often without warning. Under the surface of the skin, scar tissue known as plaque begins to form inside the penis. As this plaque hardens, it pulls on the surrounding tissue, creating a curve that grows more noticeable over time. The curve may point upward, downward, or to one side. In some men, it even twists in more than one direction. At first, the change can feel confusing or simply frustrating, but for many, it soon brings pain during erections, difficulty with intimacy, and sometimes erectile dysfunction. This is why Peyronie's disease is often called an invisible diagnosis. It hides in silence, unspoken even between partners, because embarrassment stops so many from seeking help. Yet the numbers tell a different story. Research suggests that between 3 and 13% of men live with this condition, and the real number is likely higher, since most never see a doctor. The truth is that Peyronie's disease is not just about curvature. It can shorten the penis, create indentations, or cause what doctors call a hinge effect, where the bend becomes so sharp that intercourse feels nearly impossible. But here's what most men don't realize. Peyronie's is not the end of intimacy. It is not the end of confidence. It is a medical condition with real causes and, as we will see, real solutions. The first signs of Peyronie's disease often appear quietly: a slight curve, a strange tightness, a subtle pain that wasn't there before. For many men, the early stage feels like a mystery. Something is changing, but it's hard to put into words. Doctors call this the acute phase. It usually lasts from 6 to 18 months. During this time, scar tissue is still forming. Erections may be painful, and the curve may increase month by month. Some men also notice narrowing of the shaft, an hourglass shape, or a sudden hinge where the penis bends sharply at one point. This stage can be frustrating and frightening, as the body seems to shift in unpredictable ways. Then comes the stable phase. The scar tissue stops actively growing, and the pain often fades, but the curvature remains. For some, it stays mild. For others, it becomes severe enough to make intimacy difficult or even impossible. Erectile dysfunction is also common, affecting nearly half of men with Peyronie's disease, caused both by the physical bend and the psychological stress that comes with it. These two phases, acute and stable, are the key to understanding treatment. What works in one stage may not be as effective in the other. And this is why recognizing symptoms early matters. The sooner you act, the more options you have.
Peyronie's disease may feel like an ending, but in truth, it is the beginning of a journey where knowledge, patience, and the right guidance can change the outcome. Why does Peyronie's disease happen? The truth is, it is not the result of one single cause. Instead, it begins with something small: repeated micro-injuries to the penis. These can happen during sexual activity, vigorous exercise, or even minor accidents. Normally, the body repairs such injuries without leaving a trace. But in some men, the healing process goes off course. Instead of rebuilding smooth, flexible tissue, the body lays down excess scar tissue, the hard plaques that cause curvature. Research shows that genetics also play a role. Men with family members who have Peyronie's disease or conditions like Dupuytren's contracture in the hands face a higher risk. Certain health conditions add to this risk. Diabetes, high blood pressure, and autoimmune disorders all increase the chance that normal healing may turn into abnormal scarring. Age is another factor. While Peyronie's can appear at any time, it is most often diagnosed between the ages of 40 and 70. And yet, it is not simply a disease of age. Younger men can develop it too, especially after injury or trauma. What makes Peyronie's so complex is that two men with similar injuries can have very different outcomes. One heals normally, the other develops scar tissue and a curve. This is why researchers believe it is not just physical trauma, but also an individual predisposition in how the body responds. Understanding these causes and risk factors is not about blame. It is about clarity, because the more we know why this happens, the closer we come to knowing how to treat it effectively. Treatment for Peyronie's disease depends on where you are in the journey, the acute phase or the stable phase, and how severe the curvature has become. There is no single solution for everyone, but today men have more options than ever before. In the acute phase, the goal is often to manage pain and limit progression. Doctors may recommend anti-inflammatory medication or shockwave therapy to reduce discomfort. These approaches don't always prevent curvature, but they can make the process less painful. Once the condition reaches the stable phase, focus shifts to correcting the bend and restoring function. One option is injection therapy, where medication is delivered directly into the scar tissue. The only FDA-approved treatment is collagenase Clostridium histolyticus, or Xiaflex, which can soften the plaque and reduce curvature by several degrees. Other injections, such as verapamil or interferon, may also be used in certain cases. For men with mild to moderate curvature, traction therapy has become a breakthrough option. Using a medical device for short daily sessions, the penis is gently stretched, helping remodel scar tissue. Clinical studies show it can reduce curvature and even restore some lost length. When the curve is severe or injections are not enough, surgery may be considered. Options range from plication, which shortens the longer side of the penis, to grafting procedures that replace scarred tissue. For men who also struggle with severe erectile dysfunction, penile implants can provide both straightening and reliable function. What matters most is that treatment exists and progress is real. Peyronie's disease is not a condition you simply have to accept. With the right plan, improvement is possible. In recent years, research has opened new doors of hope for men with Peyronie's disease. Perhaps the most promising is traction therapy, a non-invasive method that uses mechanical stretching to gradually remodel scar tissue. In a landmark clinical trial, men who used a traction device for just 30 minutes per day saw measurable improvements, a reduction in curvature by nearly 20%, and for many, an increase in penile length. Those who used the device longer achieved even better results.
Most importantly, these improvements lasted months after treatment ended, showing that the benefits are not temporary. This makes traction therapy unique. Unlike injections or surgery, it allows men to take control of treatment at home with minimal risk. Side effects are usually limited to mild discomfort or skin irritation, which fade with proper use. Beyond traction, researchers are also exploring combination therapies, pairing traction with injections or oral medication to enhance results. Shockwave therapy is being refined as well, showing promise not only for pain relief, but also for improving blood flow. What this means is simple. The landscape of Peyronie's treatment is changing. Men no longer face the limited options of the past. Today, there are safe, effective, and evidence-based approaches that can be tailored to each stage of the condition. The message is clear. Peyronie's disease is not the end of intimacy or confidence. With persistence and the right guidance, improvement is possible. And the future of treatment is brighter than ever. Peyronie's disease is more than just a curve. It is a condition that can affect confidence, intimacy, and quality of life. But as we have seen, it is also a condition with real answers. From understanding the two phases of the disease, to exploring injections, traction devices, and even surgical solutions, men today have choices that previous generations never had. The most important step is not to suffer in silence. If you notice signs, a new curve, pain during erections, or difficulty with intimacy, take action. Early evaluation by a urologist can open doors to treatment before the condition becomes more severe. Remember, progress requires patience. Non-surgical treatments may take weeks or months to show results, but consistency often pays off. With guidance and persistence, many men achieve straighter erections, improved function, and renewed confidence. If you found this video helpful, make sure to like it so more men can discover these solutions. Share it with someone who might be struggling in silence, and subscribe to our channel for more clear, evidence-based information about men's health after 40, 50, and beyond. You do not have to live with Peyronie's disease alone. Knowledge is power, and today, more than ever, effective treatments are within reach. Take the first step. Your health, your confidence, and your relationships are worth it.